welcome to Downriver Rescue Connection. I'm your host, Patty Radikovich, and it's my pleasure to bring you information on animal-related topics in the animal rescue community. On today's episode, we have a very interesting group, and it is the Fur Angels Pet Therapy Group. So I wanted to welcome Jan Berg-Saucy to the group.
Yes.
To the show. Thank you for coming. So on set, we have two of the pet therapy dogs with us right now, so we will introduce them, and this is Bo, right, and this is Ian.
Mm-hmm.
So, Jan, can you tell us, who are the Fur Angels?
The Fur Angels are a group of volunteers that get together and we go around and do pet therapy. We take our dogs in facilities and places where people really could use a friendly dog to show up, and it's kind of giving of the heart.
Okay. And so when did you guys get started, and how did you get started?
We started at the end of 1998, and it started by Martha Hall. We called her Marty. Mm-hmm. And she started our group. She was basically living with a disease, and they weren't giving her very long to live. So she wanted to leave something on this earth when she left. So she started our group. And instead of only having a year, as they had told her, she lasted 10 years.
Okay.
And so she started this group, and we run as an outreach from a church in Lincoln Park.
Okay, great. And then you guys are a nonprofit, correct?
We are nonprofit, absolutely.
Okay, so can you explain a little more about what exactly is pet therapy?
Well, pet therapy is, it's the loving, when you touch a dog, you really get a warm, fuzzy feeling inside. And people that have had animals, when you go in like a hospital or nursing home or a rehabilitation center, it's really nice to have a dog to be able to just touch and talk to. They don't have an opinion of you. They don't have an opinion of your life. You know, they just give you everything you want. And they will let you just love on them all day, all night.
Okay, and so what are the requirements of the dogs to be a pet therapy certified dog?
Well, the dogs have to have had some training, not necessarily real formal training, but some forms of training, so the dog is under good control. They're always on a leash, but they still need to be under verbal commands as well, so that they don't wander too far away, they don't run out of a doorway and trip somebody. They have to stay with us, they have to be fairly calm and quiet, they have to be friendly, and they have to be able to obey some commands as well. They have to be able to work around other dogs and people and medical equipment as well.
Okay. Well, we're going to do a demonstration right now, and we're going to show people the proper way to introduce themselves to a dog. So we have a few of your volunteers are going to come out here, so I'll let you introduce your volunteers and the dog.
Okay. Here we have Diane and Odie. And Odie has been a Fur Angel for quite some time now, and Diane Schuler is his owner, and she's done the training on him. And we'd like to kind of give you an idea of some of the proper things you should and should not do with a dog. So sometimes a stranger will come up to a dog, and they just kind of walk up and say hello. That's a great demonstration of what not to do.
All right, so now why do you not want to do that?
We don't want to do that because you don't know, number one, whether this dog is friendly. You don't know if he has medical issues and could be in pain, and now you're touching that area. And you don't know exactly what's going on with the dog. So you don't want to just rush up on a dog like that. If you scare them, they're liable to bite.
Okay, so we're going to have, this is, could you introduce your other volunteer?
This is Cindy Leskin,
okay,
and she's going to show you the proper way now to come up and greet a dog. And first she's going to walk up and she's going to ask a question before she does anything else.
Oh, can I pet your dog?
You sure can.
And she's going to offer the back of her hand so the dog can sniff. And then she's going to pet under the chin first, and then she can pet the dog, but calmly. If you are calm, the dog will more likely remain calm. If you're excitable, the dog's going to be excitable. So you want to be what you want the dog to be, calm. Friendly, but calm.
Okay, great. Well, thank you.
Good job, ladies.
And I think, Cindy is Bo's owner, correct?
Yes, Cindy belongs to Bo.
Okay. And so we'll see how long Bo Bo's not used to being up at these heights, so we might let Bo down in just a little bit because he sees Cindy and's like, I want to go. So, all right, so that was a demonstration on how to properly introduce yourself to a dog. So again, you want to, don't come up and hug on the dog, and you really want to teach your children this, because a lot of times I know I'll walk my dogs in the park, and these kids will just gang rush my dogs, and the dogs freak out and don't really have that great of a reaction all the time. They get scared themselves, and so knowing how to properly introduce yourself to a dog and also teaching your children how to do that is really important. I think we're going to let Bo come down. So here, I can grab Bo, and Bo's going to go right off to his owner. Well, maybe Bo will wander around the set. That's fine too. So tell us what type of facilities do you go into, and are there any qualifications for those facilities if somebody wanted pet therapy?
Yes, we go to a variety of places. We go to hospitals, we go to Children's Hospital, we go to Carmanis Hospital, Henry Ford Hospital, Oakwood Hospital, Heritage Hospital. We also go to nursing facilities, we go to rehab centers, we go to homeless shelters, we go to school programs, and it's nice to be able to do that. For a lot of these people, like the homeless people, they can't have a pet anymore. They've lost everything. And sometimes having a dog like that is really nice to be able to just go up and pet. The requirements for being there is the dog has to be evaluated, tested, and certified. It also has to come with some liability insurance. And all of these dogs have been trained and tested and certified. They have to pass at least 3 tests with us. And then depending on the facility as to what other requirements, they might have to have an orientation as far as being a volunteer at that facility, especially hospitals. They need to talk to us about safety issues and things like that to watch for in a hospital. We have to have had our TB test done yearly. We have to be up to date on our shots as well as the dogs on their shots. And we have to be able to prove that once a year.
Okay. All right, now since some people maybe don't understand exactly, to pet therapy is just bringing the dog and I pet the dog, they may not understand. So we're going to do a couple of demonstrations to show the audience what pet therapy really is about. So the first one that we're going to do is how to approach somebody in a wheelchair. So you have a few more volunteers that are coming up, so I will again let you introduce your volunteers.
Okay, this is Janice English, and this is Ian. Ian belongs to Janice, and she's going to be our patient in a wheelchair for right now. And coming up to approach her is going to be Miss Blue, and she is with her dad, Joe Barrack-Saucy. Coincidentally, same last name as mine.
Okay,
and it's a very calm stroking with the dog. Okay, it's very calm. And that way the dog stays calm. The dog's not real excitable, so the dog's not jumping up in her lap, and misbehaving. So it's a very calm, smooth thing.
Okay. And so basically if somebody's in a wheelchair, the dogs can just come and visit, and the dogs, you get the dogs used to wheelchairs so they know what they are. And
when we do the testing, they're tested with wheelchairs and crutches and canes and scooters, and we do a lot of the testing with that medical equipment to make sure that the dogs are going to be okay with it.
Okay, great. Well, thank you very much.
Thank you, Joe and Janice.
All right, and so can you explain what is the difference between a service dog and a therapy dog?
A service dog is a dog that's working for one person and only that one person. A pet therapy dog is working for everybody. And service dogs have some legal rights, and pet therapy dogs have no legal rights. You can't take a therapy dog someplace they ask you not to. A service dog has some rights to be there, so long as the owner has the right to be there. Usually a service dog does. Service dogs also should not be petted while they're servicing, because they could be distracted and it could be really critical for the patient that they're serving. Pet therapy dogs, they live to be petted.
Okay.
So, but that's again why you want to ask first. Sometimes people can't tell whether the dog is a service dog or pet therapy dog. So if you ask first, a service person is going to say, no, I would prefer that you not pet today.
Okay.
A pet therapy dog person will say, go right ahead.
Okay, and so I know sometimes it gets confusing because some people have service dogs as part of their own personal therapy, and so they might confuse people with the terminology if they say, like, this is my therapy dog, meaning it's really their service dog to help them
Right.
with, whatever they're going through.
Well, and I have, one of my dogs is also my service dog, but she's also pet therapy, but she doesn't do both at the same time.
Okay.
She's either doing service or she's doing pet therapy.
Okay. All right. So we are going to do another demonstration right now. We're going to show an example of if somebody is in a bed and you're visiting at a hospital in a bed. So we have Cindy is
Cindy
coming
again
back out.
has volunteered.
She's going to be our patient.
She's our patient in a bed. And Nancy Lindsay and her boy, Darby, are going to come up. And they're going to come in for a little visit and say hello. And that's called doing paws up, where he's trained to be able to put his feet up and being very careful not to step on any medical equipment that might be in the way, and also not to step on the patient. And Darby's very good at this, and he loves to get petted.
Okay, and the dogs are trained, so they know like about the IVs and all the wires
Yes, they
that
do.
can go in and out of the patient.
Yes, and it takes a little while before they get the hang of that. And so it's sometimes a work in progress at all times.
Okay, great. All right, well, thank you very much.
Thank you, Cindy, Lindsay, and Darby.
So now what are some other things that pet therapy dogs can do? We saw they can approach people in a wheelchair, they can approach somebody in a bed. Like, what are some other things that they might be able to do? Like, do they do a group setting? Like, if there's a...
Sometimes. Sometimes we go into, like, nursing homes, and they will have all of the people in the lobby area, and the visitors will also be there, the family members. And so we do them as a group then, and we just go around one dog per person. And you want to try to avoid doing too many crowd things around a dog, because if you make a circle around a dog between the dog and his owner, a lot of times you end up with a problem there. The dogs can get a little skittish then. They need to feel safe, and to do that, you don't want to cut them off from their owner.
Okay. Now, there are also some other programs that you do.
Yes.
And so tell us about those programs.
Okay, we do reading programs. We take the dogs to the schools, and we do primarily kindergarten, first and second graders, and the kids will come in and they will have one child or two children per dog, and the dogs lay there sometimes on a table, sometimes if it's a small dog on a table on a blanket, or maybe on the floor, and then the kids will sit there. They can either sit in a chair, they can sit on the floor with the dog. Some of the bigger dogs, they lay on top of them, and then they read the books to the dogs and show the dogs the pictures. And the dogs aren't critical then if they do something wrong or incorrect, but we've been trained to help them if they really need some help. But if it's a minor little thing, we don't usually do any correcting. And like I say, dogs don't really care if they make a mistake or not. But it helps, I think, the kids to be able to enjoy reading. And I think it's so important for children to enjoy reading.
Yeah, definitely it's a program that if children are a little bit shy or they don't want to read in front of a classroom, or sometimes they don't want to read in front of their parents, it gives them the opportunity to practice their reading skills, which obviously is really important.
We do a lot of reading programs at libraries as well.
Okay.
We'll go in and they'll give us a separate room, and we spread the dogs out and sit with the dogs, and then the kids will come in, pick a library book off the shelf, come in and read to the dogs. Little kids will come in 2, 3 years old. Well, they don't know how to read yet, but they can read the pictures, and they'll point to the pictures and make up a story.
Okay, well, that's good. So if somebody wanted to become involved with pet therapy, what are the different ways that they can be involved?
Well, sometimes people are involved in our group and they don't even have a dog. And that's allowable. Sometimes there are other things they can do. They can certainly go with us on our visits. Just because they don't have a dog doesn't mean they can't go with us. And sometimes they've had a dog and now they don't have a dog, so they still stay a part of the group. And again, they go with us on some of the visits. They can help with the dogs. And if somebody doesn't have a dog and they want to do pet therapy, a lot of us have more than one dog, and so we will help them train our dog, and then they can test and certify with our dog. Then they could use our dog. You don't have to own the dog that you're using for pet therapy.
Okay.
But you do have to be able to pass the test and be certified with that dog.
Okay. So, so there's a lot of different ways people can be involved. Now, the testing, if somebody has a dog, and you said, it requires some training. So if somebody has a dog and they want their dog to become a pet therapy dog, what are some of the first steps that, let's say they just picked up a dog from the shelter and they say, okay, I want to do pet therapy with this dog. What are the steps that they need to go through to get to the point where they can then apply to your group? Because obviously there's some training involved.
Well, depending on the age of the dog, usually they'll call me and tell me what they have and what they have going on. A lot of times then I will go and meet with them in a public place, a park, a pet store, and kind of pre-evaluate how the dog is doing. Whether the dog needs some extra training, is the dog already had enough training that it doesn't need special training, and see if the dog is ready for testing. And if it's ready for testing, then we can set up an appointment and then we put together a formal testing. And that's when they would find out if they're going to actually certify with the dog.
Okay.
But it's a matter of whether they're ready or not. And sometimes they think they're ready and we meet with them and they're not quite ready, but we can help them with that. Sometimes we send them to a training class someplace that we'll work with them that we know of already, and they'll help them to be able to pass that test. And sometimes they just need a couple of little things to show them, meet again in a couple of weeks, problem solved, and we can test them then.
Okay, so you have a dog and you assess the dog and see if it's ready, and if it is ready you go forward with the testing, and if they pass the test then you said that they are trained around the different equipment that they might be around. So how does that, like, where does that aspect fall into that? Are there special training then that you provide to show them, like, so the dogs understand, you know, this is a hospital bed, these are all the IV lines, like, where
to
does
some
that
degree,
fall?
some of it you have to kind of train on the job.
Okay.
But we have to make sure that the handler is in control of the dog and knows how to get the dog's attention. And once the dog's attention has been gotten, then it's a lot easier to work with them. Sometimes we work one-on-one with that person. Sometimes we send them to a training class. But once they're tested, they should be ready to be able to go out and do that. After they're tested and they become a pet therapy dog with the Fur Angels, then they also have to go to a couple of supervised visits where they go to places we go without a dog, and we kind of supervise that visit. Remind them what signs to look for, what to watch for. Don't let your dog sniff the floor. There could be pills on the floor, things. And then they have to go a couple of times supervised when they bring their dog with them. And then again, we have to remind them, now don't let your dog do that, or make them do this. Okay, and then again, if we think they still need a little more training, then we can give them some more assistance before they're sent off on their own to do that.
Okay, great. Yeah, because I know the, especially with the pills on the floor, that's an important part. Because I know with my dog, I had wanted to make her a pet therapy dog, but you cannot get her to leave it. And I was like, well, I can't have you eating pills. So that was unfortunately a no-go for me. Right. So can you share with us a story that maybe comes to mind, like a really good success story of where you've used your pet therapy dogs and what it's done for the people?
Yeah, we've had several incidents. Marty and I years ago went to a place in Farmington, and it was a rehab center, and there was a gentleman there that had been in a horrific accident. We don't know exactly what kind, because that was personal information, but we knew it was an accident. He came in almost comatose, and then he got to the point where he would start to use his eyes a little bit and look around, and then he started moving. And so after a few months of going there once a week, we noticed that he was trying to reach for the dogs, especially the German Shepherds. He seemed to really be drawn to those particular dogs. And eventually, we got him to where he could talk to the dogs. And what we did was we used a reward system on him, and we allowed him to give our dogs a treat if he could say their name. And so we got him to where he started coming downstairs and waiting for us at the door. And so he could say the dogs' names and give them a treat. We generally don't allow people to give them treats while they're working. We don't want them to spend more time outside than inside. So we don't allow them usually to have treats. But in this case, we did allow it. And this man, it was about 4 months later, he was up walking around and was able to go home again. And I really think, and the doctors had said, they thought the animals really helped, because that's what made him want to talk the most.
Great, and so that's a case where obviously, and that's a point to bring across, is that you don't know, you're going in and you don't know why people are there. You're just there to provide a service, and in this case, the doctors and therapists were using you guys to help with the therapy for the person.
Yes, absolutely.
And so that's great that they were able to work with you guys. And so, like, let's say somebody knows they're going to be in a facility for an extended period of time and they would like to be visited by a pet therapy dog, and that facility may not have a program set up, how does that person...
Yeah, if they call the Fur Angels, they call the phone number or send an email to me. I'll arrange for somebody to go and visit that person. We work with some hospice groups as well, and we do some one-on-one visits with people. My husband and I have done a couple of them just recently, where we went to people's houses and visited there with the dogs. And that worked out really well. People really, they were so grateful to be able to have a dog come in, but not have the upkeep or the maintenance of a dog. But they got to play with the dog. It's, you know, it's kind of fun to have the playtime, but there's a lot of work to having a dog too.
Right.
And they got to have the playtime and none of the work.
Oh,
so they were
great.
very happy about that.
Yeah, that's really great. Is there any message that you'd really like to get across to the viewers, things that they might know, that you might want them to know about your group or just about interacting with dogs in general?
Dogs can be very helpful for a lot of things, and I think it's important to get to know the dog, and people sometimes think that you kind of have to beat the dog up to get him to mind, and we don't believe in that kind of training. Yes, you should be a little bit stern with them, of course, but we like to use more rewards, not necessarily even treats. The rewards could be a pat on the head, okay, a big cuddle, they get to sleep in bed tonight. But we like to use a lot of positive reinforcing when we're doing our training, and we think that works the best for dogs, whether they're at home or pet therapy or wherever they are. And even service dogs are trained that way. Positive reinforcing is really a good way to train.
Okay, great. All right, well, I know we are coming to the end of the show. I wanted to, thank you for coming out and talking to us and explaining about pet therapy. And we'll have your information up at the end of the show if anybody's interested in becoming involved with your group, whether it's, having their own dog test for the therapy, or if it's somebody that maybe is in need of some pet therapy themselves. And so we'll have that information up for people so they can contact you guys. It's a wonderful service that you provide. So again, it's pet therapy is for anybody that would benefit from having a dog around. And you guys do exclusively dogs, correct?
We do, although I have got 2 cats that I've just recently tested, and we're trying to decide what to do with that. Obviously, we can't take them with the dogs, exactly.
Right.
So we haven't figured out how to blend that in, but we're working on it. Okay,
great. Well, I'm going to invite all of your volunteers and their dogs to come back up and join us for this show. So if you can't find the Fur Angels online for some reason, or you can always contact Basil's Buddies. You can get on our website at www.basilsbuddies.org. Ian is very happy to be with his mom. So I want to thank everybody again for coming on the show. We all look forward to a day when all pets are treated like family and everyone has a home. Until that time, we invite you to be part of the solution. And remember, please spay and neuter your pets. See you next time.
Bye.